Today, you'll be learning more about heart physiology. Our heart actually beats with an electrical current, similar to our nervous system. That's why if someone's heart stops beating, we sometimes have to shock it back alive. More on that later. Our cardiac muscle tissue are unique because they are striated, short, and branched. The reason why they are branched is to connect all fibers as one, so the fibers can all contract as one unit. One interesting aspect of our heart is the intercalated discs. Our heart has these tiny discs that allow the heart to communicate all as one unit. Our heart tissue also have massive mitochondria to provide energy to the heart all the time. Our heart is actually considered self-excitable, meaning that it generates its own electricity. This means that the brain doesn't have to continue to tell the heart to pump. The brain, however, does tell it to speed up and slow down. The heart contracts as one unit or not at all due to the special branching network and intercalated discs of cardiac tissue. The autonomic nervous system is actually what tells the heart to speed up and slow down. Think about when you get nervous and your heart beats faster. This is an example of the sympathetic response triggering from the autonomic immune system to make your heart beat faster. Let's take a moment to illustrate and talk about all the functions of the intrinsic conduction system of the heart. We call the areas of electrical conduction nodes, and we have special fibers in the heart which carry electricity. First, we have a bundle called the sinoatrial node. We abbreviate it the SA node. We call the SA node the pacemaker of the heart, as it literally sets the pace for which the heart beats. Sometimes, people who have irregular problems with this node can get literal pacemakers put in their heart to regulate it. Next, we have the AV node. The signal starts at the SA node and travels to both atria, crossing the AV node. The AV node allows both atria to fully contract before sending the signal down to the ventricles. The signal will then travel down the atrioventricular bundle, otherwise known as the bundle of His. This is in the septum of the heart. Finally, Purkinje fibers are what send the signal to the ventricles to contract. Let's watch a brief video on how these fibers work together. The way that we monitor electrical activity in the heart is through an electrocardiogram, otherwise abbreviated EKG or ECG in Europe. This monitor is what you've probably heard or seen on medical shows, as it beeps to monitor each heart rhythm. It's not directly measuring heart rate, but measures the current in the heart, which can sometimes inadvertently tell you the rate of the heart. Let's break down each part of the EKG. First, we have one little hump, then a small down, a very tall up, small down again, and one last little hump. We call each hump a wave in an EKG. The P wave is the rate of depolarization from the SA node through the atria. Depolarization is what causes each contraction. The QRS complex demonstrates when the ventricles depolarize. Let's remember that the ventricles have to contract harder as they are sending things away from the heart, like to the lungs and the whole body, whereas atria just kind of dump down into the ventricles with the help of gravity, hence the larger hump in the QRS complex. Finally, we have the T wave. The T wave is when the ventricles repolarize. Repolarization is what causes relaxation of the ventricles. You can remember that both of these words start with repolarize and relax. Now, one thing that isn't on an EKG is atrial repolarization, or when the atria relax. That's because this happens at the same time as the ventricles depolarizing. and the ventricles depolarizing is a way stronger signal than the atria repolarizing, so we don't see that on an EKG, although it does happen. Let's watch an animation that demonstrates what we see on an EKG in real time. There can be many irregularities that can be pointed out on an EKG. If you go to medical or nursing school or do anything with cardio care, you will learn more about this. Depending on the length of the waves, you can detect things like myocardial infarctions, skipped heartbeats, and more. There are several imbalances in the heart that deal with conduction. Arrhythmia is an irregular heart rhythm. This can be caused by coronary artery disease, electrolyte imbalance, or injuries from a heart attack. Fibrillation is irregular and rapid contractions. This has to be fixed with a defibrillator to help shock the heart back into rhythm. Heart block is when there is damage to the AV node. This disrupts the control systems in the heart electrical conduction. Our heart normally makes two distinct sounds, lub and dub. Here's what they sound like. The lub sound is the AV valves closing, where the dub sound is the semilunar valves closing. Let's watch the animation so you can get a better idea of what is causing these sounds.
The first heart sound, lub, also known as S1, is caused by the closing of the AV valves after the atria have pumped blood into the ventricles. The second heart sound, dub, or S2, originates from the closing of the aortic and pulmonary valves right after the ventricles have ejected the blood.
If there are any other sounds happening in the heart, this is what we would consider a heart murmur. A heart murmur is whooshing in the heart due to a valve not working properly. If blood strikes obstructions like valves, it creates a whooshing noise. Let's listen to a few different types of murmurs. Lastly, our heart has a distinct cardiac cycle. The cardiac cycle is a period of time of contraction and relaxation. Diastole is the period of relaxation, and systole is the contraction period. Both of these contribute to blood pressure. Let's watch an animation demonstrating diastole and systole in the cardiac cycle. Blood pressure is how much pressure is exerted against our blood vessels, particularly our arteries. When the heart is contracting, the pressure is much higher on our arterial walls. With blood pressure, we normally represent it as systolic over diastolic pressure. The normal blood pressure reading is about 120/80. Hypotension is when blood pressure is too low, and this usually happens due to an illness. Hypertension is much more common and much more serious if it's over 140 systolic pressure. The reason why it's serious is because chronic high pressure can damage the arterial walls, causing them to form scar tissue and thicken. This can cause the heart to pump too hard and can actually lead to a myocardial infarction. High blood pressure can be caused by high stress, so that's why it's important to try to lower your stress levels. Heart rate can be impacted by a number of factors such as age, gender, exercise, and body temperature. Fun fact, A fetus's heart rate is actually more than double ours. If our heart rate is chronically high, we call this tachycardia. This can happen from nervousness, but it can also be a sign of drug use, stress, or heart disease. If our heart rate is chronically low, we call this bradycardia. I like to joke and say Tom Brady is slow, and when you have bradycardia, your heart rate is slow. Sorry, Tom Brady fans. Bradycardia can happen due to drug use or happens normally when you are resting and sleeping. A normal adult actually experiences a few abnormal heartbeats every day. If you suddenly feel your heart fluttering but then it goes away, it may have just been an abnormal heartbeat, which is totally normal. Sometimes when we get anxious, you can get what's called heart palpitations, which is more irregular heartbeats. If this happens frequently, it may be a sign to visit your doctor, as this does cause stress on our heart muscles.